We are still winning, but we have not yet won the fight against the pandemic, and that will continue to be a fight that we will wage over the course of 2021. In the most recent outbreaks over the summer, the systems have been put to the test in New South Wales, in Victoria, and today the case that has been announced in Queensland will similarly present a test. But we have seen that test passed, not just by the systems that have been built up by those jurisdictions, as we have battled that virus throughout the course of 2020, learned the lessons, improved the systems, upgraded, working together. But it is also a test that is increasingly and continues to be passed by the Australian people, whether those up in the northern beaches of Sydney or the suburbs of Melbourne or indeed in other parts of the country. We say thank you for your patience, for your perseverance and your cooperation. And we will continue to work through those issues as we battle that virus, as we have been so successfully over the course of now 12 months. Almost 12 months ago was when the then Chief Medical Officer, Professor Murphy, came into my office and briefed me on the situation regarding the coronavirus at that time. So we will continue to put our trust in those systems that have been built up, and we commend everyone who's doing that job out there today, getting tested, conducting the tests, getting the reports back to people, seeking to minimise the disruption to their lives as much as possible, whether they're at the cricket in Sydney or they're at home or in isolation or wherever they happen to find themselves, including we are mindful of those in Western Australia at present who are fighting fires north of Perth. I've been in contact with the Premier today, and they are on top of that situation. There's been no request for federal assistance on that matter, but the Premier is aware of the availability of support if they should need it. The vaccination policy that was adopted by our federal cabinet in November and subsequently also endorsed by the national cabinet has been put into action in these months since then as we prepared for the rollout of the vaccine. This is ultimately a partnership between the federal government. It's a federal vaccination policy, but with all vaccines, they are done in partnership with the states, and we've been following those processes. This is not the usual vaccination arrangement that we'd have, given its significance, and on this occasion the federal element of this vaccination policy has been driven very much by the Health Secretary who joins us today. The vaccination in 2021 is a key component, obviously, of how we're dealing with the pandemic here in Australia. Throughout the course of dealing with this pandemic, we have been dealing with this in a very Australian way. Of course, we are mindful of the experiences and the lessons that we can learn from other jurisdictions. Over the course of the past year, I've probably had more discussions with leaders of other countries than Australia has seen for a very, very long time. And I've found all of those engagements, as has occurred also by the Health Minister and indeed our other health officials, other Chief Medical Officers, whether in our own region in the Indo-Pacific or more broadly further afield in the United States, Canada and of course throughout Europe and the UK. But Australia has been making its own way through this, and we've been tailoring our response to our conditions, our challenges and our needs. And we have had great success by comparison. It is a terrible tragedy that there are countries in the world today who are seeing daily death rates from COVID-19 that are higher than the total number of deaths that Australia has sadly experienced in the course of the past year. And I must admit, when I reflected on that figure in the last couple of days, it was incredibly sobering. More deaths in one day from COVID in many jurisdictions than Australia has experienced in the last year. And so we find ourselves in a different situation, a situation not unlike countries, whether it be like New Zealand, South Korea or Japan. However, I note in recent times they have also seen an increase in cases. So we will continue to make our Australian way through this COVID-19 pandemic and seek to continue to achieve the same success that we have to date and manage the disruption as well as we possibly can, both to our economy and the daily lives of Australians. Our officials have been moving swiftly and safely to introduce the vaccine here in Australia as soon as is safely possible. Doing that is critical to public confidence in the vaccine. We have set out cautious timetables and outlined them to you over months now, and the Health Minister has engaged most significantly in communicating that to the Australian people. But behind the scenes, the officials you see here have led a process with their counterparts around the country, but particularly within the Federal Health Department, to ensure we are seeking to better those timetables. We don't want to make promises that we can't keep. That is incredibly important. We will tell you timetables when we can have confidence in those timetables, and we will continue to update those timetables as more information is known and as improvements continue to be made. We know what we know, and we will base our information and our timetables on that rather than speculating. There have been no delays in the introduction of the vaccine in Australia. There has been the necessary swiftness that has been asked of the TGA and, of course, the health officials that are driving this process. It is moving considerably faster than normal vaccination approval processes would occur in Australia, but without skipping a step, without cutting a corner, ensuring that everything that needs to be ticked is ticked along the way. But the priority that I and the Health Minister have placed upon this vaccination is to ensure that that is the goal, that is the task, that is the major thing that needs to be worked on by the TGA and by our health officials to move swiftly to have this in place. So there has been no delay and no deferral. This is going as quickly and as safely as possible. Our health officials and experts, led by Professors Murphy and Kelly, have taken us through this process again this morning and the work that's been done over this summer break. And I want to thank all of those officials who've been working incredibly hard, particularly over these last several weeks, to get things in place to advise what we can today. After considerable effort, including with our vaccine suppliers, we are now in a position where we believe we'll be able to commence vaccinations of high priority groups in mid to late February. So we're talking about next month. This will, of course, remain conditional on a number of important factors, most importantly, that final TGA approval and the delivery of the vaccine from our suppliers. To step this out, and the Health Minister will go through a presentation, and that'll be followed by Professor Murphy and Professor Kelly. The Therapeutic Goods Administration, we are hoping to secure all the data, the final data, which they've been accumulating on an incremental basis now for some weeks, to have that mid this month. We then envisage that we can, that is from Pfizer, I should say, we then envisage to be hopeful of an approval subject to all the data and issues that may arise from that being resolved by the end of January. AstraZeneca, we expect that process to be completed in February, but we cannot give you a closer timetable around that. Pfizer's global protocols require approximately 2 weeks for delivery post-approval of the vaccine. So the vaccine does not arrive pre-approval. The vaccine is only released and distributed to countries once the approval is provided. Now, you remember, this is a vaccine that has to be stored at sub 70 degrees Celsius, and that obviously has logistical issues, and that is what is addressed by Pfizer, and so that is around about a 2-week time frame. Outside of that, there's about another up to a week, which is required for batch testing of those received vaccine doses. There are many other issues which Professor Murphy will also speak to, which go to the distribution of the vaccine. There is the registration process. One of the issues that is already presenting itself is there can be confusion around the vaccination process and who has received what vaccines. It's very important that that is crystal clear, and a process has been established already to ensure that that certification is in place, and so everyone will know who has received what vaccines. Because once you get the first dose, within a couple of weeks to a month, you also need to receive the second dose. And so it is not just one shot here, it's a 2-shot process, and that has to be managed particularly for the priority populations.